RegenerWave urology is a set of protocols developed to help reverse the damage of aging to the circulatory pathways leading to the penis. The extracorporeal lithotripter used to perform RegenerWave is an FDA Class 1 cleared device. This device is shown in clinical trials to stimulate angiogenesis, the formation of new blood vessels. Some other devices that transmit sound waves elicit no more mechanical stress than the vibrations given off by a washing machine during the spin cycle, and simply do not elicit enough energy to cause transient shear micromechanical forces that initiate biological changes sought after to heal, reverse, and rebuild affected tissues and blood vessels. It is important to appreciate the skill of the medical provider when performing sound wave therapy. RegenerWave urology is performed exclusively by extensively trained physicians or physician assistants, not medical assistants with no formal medical degree. Our medical providers obviously completed formal cardiology, immunology, anatomy, and physiology courses in medical school and went on to extensive hospital training under close supervision and scrutiny. This is important as medical assistants or technicians without advanced education can damage the sensitive areas of the penis, causing urinary or sensory problems for life. My patients have had much success with RegenerWave treatments. With RegenerWave urology, a patient is first consulted and a thorough medical evaluation is completed. A patient then undergoes a duplex ultrasound study to visualize the degree of blood flow to the dorsal arteries of the penis. This gives the medical practitioner an objective measure of the erectile quality. A patient then fills out a SHIM questionnaire, or a sexual health inventory for men, which is an erectile function questionnaire. Some may know this as an IIEF or IPSS. The patient's responses are then totaled and a final score is produced, which tells the medical provider what category, if any, of erectile dysfunction the patient lies in at the moment. This is an example of a subjective measurement based on the responses of the patient at the time he answers the questionnaire. Now I have a baseline, and from talking to the patient, I have a good idea of his goals. Most patients share a common goal, which is to successfully achieve an erection. But I like to expand on that goal and ask about the quality of that goal. Is it harder, longer lasting, more frequent and spontaneous, easier to penetrate? And lastly, is there more sensation or sensitivity? What is the level of pleasure, both mentally and physically? A series of 6 RegenerWave treatments in a period of 3 weeks is recommended. The patient is to fill out a SHIM questionnaire at each visit prior to the beginning of the session. I like to ask questions about how the patient did at home, either with a loved one or by himself, to find out if the erections began to show improvement from one session to another. Once a course of RegenerWave therapy is completed, the duplex ultrasound study is repeated 4 to 8 weeks after the final session to determine the degree of improvement objectively that a patient obtained. We're talking about blood flow, perfusion of oxygenated red blood cells to the penis. A last SHIM score is calculated to show subjectively any changes in the patient's symptoms, much improved since the first SHIM score was calculated weeks prior. This usually puts the patient into a new category, mild ED or no ED.